The House Committee on Education will come to order. Will the clerk please take attendance?
Chair Colazar.
Here.
Representatives Churches.
Present.
Shannon. Weiss.
Here.
Glanville.
Present.
Conlon.
Present.
Edwards.
Here.
Wagella.
Here.
Song.
Present.
Green. Markkinen.
Here.
Paquette. Wenzel.
Here.
Johnson.
Here.
Mr. Chair, you have a quorum.
Thank you. Representative Weiss moves to approve the minutes of the November 12th meeting without objection, so ordered. Okay, so today we are going to start with testimony only on the changes to the school safety package. And so Representative Breen, you are up to talk about the changes to the package.
Morning, Mr. Chair. Thank you to the committee. Thank you to the, I don't know, what feels like thousands of people that have given their input on these bills, and especially a big thank you to Asia Jackson, sitting right there next to you, who has been tireless in helping in bringing this package to fruition. So before you today, there are 5 bills from the school safety package, and I'm just going to summarize some of these changes. House Bills 4095 and 4096, these have to do with terminology, making sure that in the event of an emergency situation, that law enforcement, that any first responders coming to an incident at a school, whether it be a fire, biohazard, or any number of things that could happen, we want to make sure everybody's on the same page, that everybody's using the same terminology, and that there are no mix-ups. The words all clear, just as an example, we need to make sure that that means the same thing across the board, whether or not a room is empty or whether or not a room is just full of kids. We need to make sure that all the people are on the same page. So House Bill 4095, that is updated to start with the 26-27 school year. House Bill 4096, that adds language to require local law enforcement to use the standardized response terms along with the schools. Those are really the only changes to those 2 bills. The behavioral threat assessment, the implementation date is shifted to October 1st, 2026. It adds non-public schools. It requires that law enforcement officials, except for school resource officers, be an agency that has jurisdiction over the school. And just to remind people on what the behavioral threat assessment bill is overall, we have just passed the 3rd-year marker for the horrific shooting at Oxford. Oxford had a threat assessment policy. It was not implemented, and we've seen the horrible results of that. So this bill would also require MSP to make training on how to use threat assessment materials available to schools upon request. And it clarifies that the behavioral threat assessment team is responsible for educating the school community about the warning signs that somebody could be a risk of harm to themselves or others. We also have the next set of bills are the School Safety and Mental Health Commission. I forgot to give a shout out to my friend and colleague Luke Meerman, who wasn't here earlier, but the commission, just so a bit of background, there was a commission formed in the wake of Parkland under Governor Snyder. That commission is still ongoing. However, it is focused mostly on physical security threats. What the intent was behind this entire package is to make sure that we bring together everybody in the education community. We're bringing together law enforcement, school safety personnel, teachers, of course, mental health professionals, an all-encompassing commission. And so what these bills are now going to do is they are phasing out the first commission. There was another commission added in boilerplate a couple years ago, and that commission is the one that we are putting back under the umbrella of Michigan State Police. And so this commission is going to have everybody on it, and you're going to have all the experts in education, school safety, mental and physical security in under the same umbrella. So this commission, this will allow MSP, Michigan State Police, in consultation with the commission to hire staff. It will remove duplicative reporting requirements so that you don't have to report things twice. And those are the biggest changes in that bill. And I'm happy to take any questions.
Okay, Representative Glanville.
Thank you, Rep. Breen.
truly appreciate the effort that has gone into this. It's been
It
a
has
big
been
lift,
a
and
Herculean effort.
yes, no. So pleased to see this coming before us for a vote here today. One clarification I was looking for is with the terminology plan. I didn't see in there, and maybe I missed it. Who will be guiding that work to make sure that it is consistent? Is that Michigan State Police as well?
We want Michigan State Police to run this in consultation with the commission.
Okay.
There are certain things you don't necessarily want 6-year-olds to overhear, in addition to making sure that everybody's on the same page. So we want to make sure that the vernacular being used is appropriate, that is for everybody across the board. So what would the whole goal is to have MSP take the reins, but to run everything through the commission.
Okay, great, thanks.
Representative Song.
Thank you, Chair. Hi, Representative. I have 2 questions. My first question is, will schools be held accountable if they fail to implement these plans?
We've seen what happens when schools don't follow these
yes.
plans. So as far as any type of an enforcement mechanism, that has been one of the biggest cruxes and hurdles here. You don't want to penalize schools because that will ultimately just hurt the kids. After an insane amount of conversations with various superintendents, school board members, parents, teachers, the whole goal is to keep kids safe. And as far as what would happen if they didn't, we've seen what happens if they don't. So that is essentially the enforcement mechanism.
Got it. My second question is regarding the commission. What is the fiscal impact? Do we have any numbers on what impact that would be to the
The
budget
commission's
to
already
create
funded.
it?
It's already, they already have
What's the
money. They
amount?
have about $2.5 million, I believe.
Okay, thank you. Thank you, Chair.
Any other questions? Rep Johnson, do you have a question?
I'm always happy to talk with you offline too, ma'am. So.
It's up to you. No pressure. Okay.
Thank you. First of all, you did an outstanding job, and this whole package is a wonderful start for public schools. And I would prefer the non-public schools be offered the opportunity, but not have the burden of the strict defining which kind of a resource officer, what kind of a mental health professional. The definitions need to be widened, or it needs to be offered to the private school groups. Michigan Association of Christian Schools has called me and told me they are a definite no on this because mental health professional does not include clergy. They are counseling families all the time in all parameters of life. If it could include that, we could have that discussion again. But I want to be a yes on all of it, but that's holding me up here. I just want to make everybody aware of that. Private schools can be offered this to participate, but to require for them to put together teams of professionals they don't have on staff in the same defining roles, but are still participating in the activity of that. I think we need to have a discussion on redefining what mental health professional is and all of the rest of it.
And I appreciate you bringing that up, that as I mentioned before, some of the things that you brought up were not brought to us. We were asked by some of the non-public schools to make sure that they were included because kids should be safe no matter where they are. And I want to be very, very clear to everybody on this committee and everybody in the audience. Statistically speaking, schools are the safest place for kids. They are safer in school than they are in a lot of other places. And so I don't want to be feeding into a narrative where people think our schools aren't safe. They are. Our kids are safest in schools where they are not only surrounded by their peers, but they are surrounded by loving educators that have made it their life's work to keep our kids safe and to help educate them. And I'm proudly married to a public school teacher. I am the daughter of a public school teacher. I have 2 kids in public schools in Novi. That being said, I went to private school for a while, and my mom, who is the eldest of 9, only half of them went to private school because private school is expensive, and when you have 9 kids, that's not feasible. But I want those kids to be safe, and I think we all want them to be safe, and I'm not disputing that, and I understand the burden that this could create. If there is a possibility that we could come to an agreement for an amendment, I'm absolutely happy to discuss that. A mental health professional is somebody who is licensed in either psychology, psychiatry, or I believe social work. And those are people who are already on staff at pretty much every single public school, as well as, from what I understood, most privates. But this shouldn't necessarily cost anything, but again, you brought up a concern that hadn't been raised before, and I'm happy to discuss that to see if there's something that we can do to work it out.
Okay, any other questions? Representative Glanville.
Not to belabor this point too much, but in looking at the way that the commission is designed, it doesn't exclude clergy, right? It
I don't believe so.
a member who has experience in X, a member who has experience in Y, a member who has experience. So I would think that private schools or non-public schools, especially for a clergy member, and certainly having worked in Catholic schools for a number of years, I understand the role of clergy in how a school is run in that sense. And those folks generally have those other qualifications as well. They are teachers, they are administrators, et cetera. So I feel like there's an opportunity. I don't know that this needs to hold this bill up. There is opportunity for clergy to be included on these teams and licensed psychological professionals.
Sure. Just to be clear, there's the commission, and then there's the separate threat assessment team in each school.
Same comment.
Okay.
Other questions? Rep Weiss.
And just a point of clarification, if a clergy member at a school was also a licensed mental health professional, they would qualify.
Absolutely.
Okay. Thank you, Representative Breen. Also, just for everybody here, because as you can just tell by looking up here, we are down members on both sides of the aisle. So because this has been a bipartisan effort, I would like to give every member the chance to be here to vote on the bills. So it is our intention to vote these out next week. Thank you, Representative Breen. Next, wishing to speak and supporting the bill, or it looks like three of the bills, 4095, 4096, and 5549. We have Jamie Taylor and Katie Kavanaugh from Okemos Schools. Okay, this is going to sound, is it Okemos or Okemos? I did get it right. Good. I was the right one the whole time. Okay, good to know.
Although if you listen to commercials, Okemos, but no.
Thank you for asking. Thank you for having us here today. I'm Jamie Taylor,
I'm Katie Kavanaugh.
and as mentioned, we are school board trustees in the Okemos Public Schools, and we are here today, as mentioned, to speak in support of 4095, 4096, and 5659. And I did prepare a written, but then I'm going to ad-lib just a smidge. First of all, thank you for the opportunity to express our strong support for these bills, which will require public and non-public schools to adopt standardized response terminology plans and establish behavioral threat assessment and management teams. As many of you may know, some of you may not know, in February of 2023, our district experienced a traumatic swatting incident. And although the threat was ultimately determined to be false, the initial response was harrowing. I myself received a text from my own son, who was hiding in a small closet, thinking that there was an active shooter in his building. I was actually with Trustee Kavanaugh at the time that we both realized something was happening. Our district went into lockdown, our entire district, all of our schools, because we didn't know what was happening. And law enforcement from across the region, the Ingham County Sheriff's Office, Meridian Township Police, East Lansing Police, MSU Police, and the Michigan State Police all responded. As mentioned, we had students sheltered in bathrooms and closets, terrified and unsure if an active shooter was in the building. It was a moment that no parent or child should ever have to endure. Meanwhile, our superintendent was entering the building under the belief that there were injured or deceased children and staff. And while we are profoundly grateful that the threat was not real, The experience highlighted critical lessons about school safety. One of the most urgent is the need for standardized safety and security terminology. Law enforcement officers often serve multiple districts, and a lack of uniform language creates dangerous inefficiencies. House Bills 4095 and 4096 will establish a standardized approach across districts and law enforcement, ensuring that first responders in schools use consistent terminology for quicker, safer, and more effective responses to emergencies. Even before the spotting event, our district had engaged Jason Russell and his team at Secure Education Consultants to improve our safety protocols. Following the incident, SEC supported our reflection process, leading to the implementation of robust behavioral threat assessment and management systems. We've been, I think we're almost 2 years in now, to having these BTAM teams in all of our buildings. And under the guidance of Dr. Margaret Coggins, an expert in BTAM, we created teams in every building to identify and address potential threats early. These teams work closely with counselors, social workers, and when appropriate, local law enforcement. As a result, we have been able to intervene proactively, protect our students, staff, and community. This is why we also strongly support House Bill 5559. We have been living the benefits of having these teams, and it has been really eye-opening when we see how not just how we can intervene to prevent situations, but the support that we are able to provide to our students because of these BTAMs. Yes, in the end it prevents potential violence, but there is an entire team in every building that is there to support our kids. And we've been able to give them not just internal supports with our own mental health professionals, counselors, social workers, psychologists, but also outside resources if necessary. It has made a remarkable difference in the amount of support that we're giving to our kids. And that, of course, is what we're really all here for, is to make sure that our kids are safe and supported and given the resources that they need. In closing, we believe these bills are vital steps towards safeguarding our schools, ensuring that educators, students, and families are protected through standardized terminology and proactive threat assessment measures. Again, thank you for your time and your commitment to the safety of our schools.
Okay, thank you very much. Thank you for being, and also thank you for being school board members. It's a thankless job. Thank you. Okay, some other cards to read in. Not wishing to speak, supporting House Bills 5095, 4096, 5549. Actually, all 5 bills that were in the school safety package today. Bob Kefchin, Michigan Association of Secondary School Principals. Not wishing to speak, supporting the bills, Jennifer Smith, Michigan Association of School Boards. Not wishing to speak, supporting the bills, Brian Broderick, Michigan Association of Non-Public Schools. Not wishing to speak, supporting the bills, Paul Stankowitz from Michigan Catholic Conference. Not wishing to speak, supporting the bills, Dr. Cheryl Kennedy, MDE. Not wishing to speak, supporting the bills, Mary Pollock, American Association of University Women of Michigan. Not wishing to speak, supporting the bills, Noah Smith from Michigan Association of School Social Workers. Not wishing to speak, supporting the bills, Noah Smith from Michigan Association of School Psychologists. Okay, thank you. Next up, we are going to move to House Bill 5174, the organ donation presentation bill that we took up a few months back. Representative Brayback is going to speak to changes to the bills, or basically going to speak to a substitute.
Good morning, Chair. Thank you. Morning, committee members. Very straightforward. You've heard testimony on this before with reasons why we should do this. I feel like the compelling reasons, couple changes. One, it doesn't make this mandatory, so the department will create the material and then schools have the option. The second part is that parents still, if the school decides, yes, we want to provide this to our 9th graders, parents still have the option to opt their student out. Short and sweet.
Okay, any questions? Okay, thank you.
Thank you so much.
Need a motion to adopt the substitute. Representative Edwards makes that motion. Will the clerk please take the roll?
On the
motion of adopting the substitute, Chair Colazar.
Yes.
Representatives Churches.
Yes.
Shannon. Weiss.
Yes.
Glanville.
Yes.
Conlon.
Yes.
Edwards.
Yes.
Wagella.
Yes.
Song.
Yes.
Green. Markkinen.
Yes.
Paquette. Wenzel. Johnson.
Yes.
Mr. Chair, you have 10 yeas, 0 nays, 0 pass. The H2 substitute is adopted.
Okay, thank you. And now I need a motion to report House Bill 5174 as substituted with recommendation. Representative Wagella makes that motion. Will the clerk please take the roll?
On the motion to report, Chair Colazar.
Yes.
Representatives Churches.
Yes.
Shannon. Weiss.
Yes.
Glanville.
Yes.
Conlon.
Yes.
Edwards.
Yes.
Wagella.
Yes.
Song.
Yes.
Green. Markkinen.
Pass.
Paquette. Wenzel. Johnson.
No.
Mr. Chair, you have 8 yeas, 1 nay, 1 pass. House Bill 5174 is reported for recommendation as substituted.
Thank you. And also, not wishing to speak, supporting House Bill 5174, Patrick Wells O'Brien from Gift of Life, Michigan. Not wishing to speak, supporting the bill, Dr. Cheryl Kennedy, Michigan Department of Education. Not wishing to speak, supporting the bill, John Hoffman, American Kidney Fund. Not wishing to speak, supporting the bill, Rachel Kunich. Sorry if I mispronounced that, from who herself was a heart recipient. Thank you. Okay, next up, House Bill 5735, which has no substitute. So I need a motion. Rep. Glanville makes the motion to report House Bill 5735 with recommendation. Will the clerk please take the roll?
On the motion to report, Chair Colazar.
Yes.
Representatives Churches.
Yes.
Shannon. Weiss.
Yes.
Glanville.
Yes.
Conlon.
Yes.
Edwards.
Yes.
Wagella.
Yes.
Song.
Yes.
Green. Markkinen.
No.
Paquette. Wenzel. Johnson.
No.
Mr. Chair, you have 8 yeas, 2 nays, 0 pass. House Bill 5735 is reported with recommendation.
Thank you. And also, not wishing to speak in supporting House Bill 5735 is John Severson from, is it Severson? From Michigan Association of Intermediate School Administrators, MAISA. Also, before we close here, I do want to take a moment. We have a retiring member of MDE who had no idea I was going to put her on the spot today. So Dr. Kennedy is going to be retiring at the end of the month. And I just want to thank Dr. Kennedy, not just for her service to the Department of Education, but also as an administrator, as a teacher. She has dedicated her entire professional life to helping all of Michigan's kids. And I just want to thank you for your service. And with that, Representative Conlon moves to excuse absent members without objection, so ordered. And there being no further business before the committee will stand adjourned.